Hello, scholars! My name is Dr. Kerris Dillon, and the goal of this channel is to make academic subjects easier to understand. If you haven't already done so, please click the subscribe button and don't forget to like the video. That way I can keep producing the videos that you like best. In the last video, we talked about illness anxiety disorder. In this video, we're going to discuss conversion disorder, so let's begin. Many of you have probably heard about the dozen teenage girls in Leroy, New York in 2011 and 2012 who were sickened at the same time with uncontrollable tics as well as stuttering. If you haven't seen any video of it, it is available on YouTube if you just put in Leroy, New York, and then mass hysteria. Essentially, about 12 girls that go to the same school started to have neurological symptoms which resembled Tourette's disorder. When all 12 girls were examined by the same doctor or various doctors, no physical origin was found, and doctors began believing it was conversion disorder. The health department did come into the school and performed various tests on the physical building, but nothing was found. The school itself performed tests, and again, nothing was found. The parents felt more than frustrated watching their daughters suffer with tics each and every day. What one doctor tried to explain over the news media was that the girls were thought or believed to have conversion disorder. Now you're probably wondering, what the heck is conversion disorder? Well, in order to be diagnosed with conversion disorder, according to the DSM-V, the individual has to experience altered movement or senses stimuli differently than other people. That's the first component, that's A. B, the person has symptoms that don't align with their neurological or medical conditions. So meaning when they are tested for neurological conditions, they are fine. The origin is not neurological and it is not a medical condition that can explain what's going on. C, there isn't an alternative medical condition or mental condition that can better explain the individual's symptoms. And then D, the person's symptoms cause impairment or distress concerning their relationships with others, their schooling, or their work. So this impairment tends to need medical care or attention. So although the symptoms are very real, there is no medical cause for them. So in the case of these 12 girls that had these strange tics, physical tics, and then some of them had stuttering as well, they were all tested for neurological conditions as well as other medical conditions, and nothing was found. And so therefore, the diagnosis tends to be conversion disorder, that there is a psychological reason for these tics, and a psychologist can work and a psychiatrist can work with these individuals, but no medical diagnosis is found. Now, if you are a clinician, you will also want to specify, if you decide upon conversion disorder as the diagnosis, if the person has paralysis or weakness, whether they have abnormal movements as compared to their peers, have swallowing issues, have trouble with speech, if they have seizures, if they have sensory loss, or if they have various sensory symptoms. The clinician will also want to state if the symptoms have been present for less than 6 months, which is called an acute episode. Now, if the symptoms have been present for more than 6 months, we call that persistent. I found it interesting that one of the girls talks about having an advanced stage. Now, to me, advanced means more severe, but I think she was stating it like the tics had moved their way through and that she was coming on the other side of not having as many tics anymore. When a person has conversion disorder, they tend to have one or more symptoms that affect various parts of their body. Motor symptoms may include, but are not limited to, abnormal movements, paralysis, weakness, or trouble with walking. Sensory symptoms may include, but are not limited to, not being able to feel somebody touching them, trouble with their hearing, trouble with seeing, or a reduction in the feeling of their hands or their legs or other parts of the body. They may experience some loss of consciousness, which may look like a seizure. There may be times where symptoms compare to a person being in a coma, which I'm sure is very frightening. Other types of symptoms may include not being able to talk very loudly, trouble articulating one's words, having a lump in the throat, and/or double vision. A clinician should not make the diagnosis of conversion disorder just because their patient has strange or bizarre symptoms. They need to rule out neurological disorders before any diagnosis of conversion disorder is made. Most people that are diagnosed with conversion disorder have had a past history of trauma. Even if a person has not gone through stress, though, a diagnosis of conversion disorder should not be withheld. Generally, most individuals with conversion disorder don't tend to be terribly obsessive over their symptoms. So this is not a diagnostic part of the criteria of conversion disorder, though. So about 2 to 5 individuals in 100,000 individuals are diagnosed with conversion disorder each year. Symptoms tend to come and go with some individuals, and for others, they can be more persistent. In some cases, those that have experienced child abuse and neglect as children are at more risk for a conversion disorder. This disorder is more common in females than it is in males. Some individuals with conversion disorder are severely disabled and will need help in their day-to-day lives. It is very normal for an individual with conversion disorder to have panic attacks, an anxiety disorder, or a depressive disorder. And personality disorders can also be seen with persons that have conversion disorder. Well, all right then, we have reached the end of our video. Just want to remind you that so far we've taken a look at somatic symptom disorder, illness anxiety disorder, and conversion disorder. So the last video that we're going to take a look at in this series is called factitious disorder, which is extremely interesting because not only can it affect an individual, but it can affect a parent or a caregiver pushing an illness onto somebody else that is not a true illness, which can be a spouse, which can be a child, or it even can be a pet. So you don't want to miss that one. I appreciate all of you so much for hanging with me with this channel, and I very much care about you, and thank you very, very much. Have a good day. Bye-bye.